Well, here we go. Veterans Action Council, Roundtable number 16. I'm Ricardo Pareda, and I am honored to introduce today's guest, Mr. Arron Victory, a Canadian veteran who is going to let us know what they got going on there in their maple syrup up in Canada. We got a couple other veterans who are interested, and rather than drag it on, I'm just gonna do a little round robin, let everybody introduce themselves, and then we'll jump right into what you got going on up there. So Pearson, you wanna introduce yourself and we'll just go around?
Yep. Hey everybody, Pearson Crosby. I was in the Marine Corps 2004 to 2008. Looking forward to this conversation because it definitely is Canada is definitely a little bit ahead of us when it comes to how they treat their patients. So I'm excited about having Arron on, and look forward to the conversation.
Mr. Land, you want to jump in, introduce yourself?
Yeah, my name's Tony Landry. I served 6 years in the U.S. Navy back in '88 through '94, and I'm in the Veterans Action Council to bring cannabis to veterans through the VA and other medicines as well. But I'm happy to be here tonight and hear what Canada has in their program, in hopes that we can model some of that in the United States veterans health system. So thank you.
And jump right in there, Arron or Robert.
Yeah, I'll go. So hi guys, my name's Arron Pluff. Volunteering with trying to find help with the Veterans Action Council. We were talking here in Victory today about what Canadian medical cannabis looks like. And I was in the Marines and I served with actually served with Pearson. So we're going through this together, and just like Band of Brothers anywhere else, interested to hear what everyone else got to think about this.
Robert Kowalski, from Ohio, and I served in the U.S. Air Force, and it's a pleasure to have you here with us, Arron.
And then the guest of honor, Mr. Victory. How are you doing, sir? Thank you for joining us.
Thanks for having me, fellas. Thanks for having me. My name's Arron Victory. Spent 14 years in the Canadian military, in the Army, in an infantry battalion, 2nd Battalion, Royal Canadian Regiment. Most of that time hanging out in reconnaissance and sniper subunits. When I got out in 2016, started consulting in the medical cannabis space and started working with some veteran-focused clinics and licensed producers. And then in 2018, started dipping my toe in advisory positions in cannabis and psychedelics. And this fall, I'll be launching my own cannabis brand in medical and recreational streams here in Canada. So that's kind of a Coles Notes version of what Arron's been up to.
I love it, man. So how long have you been engaged in this medical program, and like what brought it to be? How did you guys get on this course that brought you to where you are now, which is really leading in the field?
So I've been a medical patient on the Veterans Affairs Cannabis Reimbursement Program since 2016, when I got out of the military. And then as far as the program, in 2001, a patient, and his name escapes me, stood up and said, it's less of, there needs to be so much evidence-based research on cannabis, and it's more of a human rights issue. And the Canadian Supreme Court agreed with him. And in 2001, he was granted access to medical cannabis for therapeutic purposes. In 2007, the first veteran gained coverage. But at that time, it would be under a psychiatrist or a specialist. So no GPs, you're going to need a specialist. And then in 2014, that changed and GPs could write for the prescriptions for veterans. And then we saw the growth of veteran-focused cannabis clinics. And that's how the patients were aggregated from about 2013, 14 till last year. The largest pharmacy chain in Canada, Shoppers Drug Mart, launched their medical cannabis program, and in my opinion, will be the long-term winner in the medical cannabis game in Canada.
And so you guys just went straight to the constitutional challenge, and then it sounds like your politicians were pretty open, like obviously they were open to it. You guys moved like at lightning speed. What do you credit that to? Right? The willingness to adapt this, when here in the United States, I mean, you see what we get. We get all kinds of accusation and then obstruction and calls for research and then ignoring research and just all kinds of things.
Yeah, so I'd say the main difference is Canada's liberal attitude towards cannabis in general. I mean, everybody on this call probably heard of V.A.C. bud, and you guys are everywhere from Arizona up to the East Coast, right? And probably some of you probably never even been to Canada, but the cannabis culture and the legacy in Canada for sure. But just to put it into perspective, veterans are still the only demographic in Canada and North America for that matter that have blanketed insured coverage. So even today, legalization happened in October 2018 federally in Canada, and even today, veterans make up a fair portion of the market. I think the last time I checked, it was about $600 million in the last 12 months for the medical cannabis market in Canada, and veterans made up just shy of 90 million of that. So a tangible percentage.
And with relation then to the pharmaceuticals and the prescriptions being doled out, what are the comparisons that can be made there? Are you seeing a reduction of pharmaceutical reliance and overprescribing? Is it saving y'all money? Are you spending less money on the pharmaceutical approach and then doing more with less on the cannabis side of the house? How's that looking?
Can't speak to the comparison between how much it would be saving. That would be an actual Veterans Affairs question. But I can say that the Veterans Affairs has seen a reduction in prescribing opiates to veterans who avail of the cannabis reimbursement program, without a doubt.
I'd like to ask you a question there, Arron, about like the quality. So kind of big picture and then small picture, but the quality of the healthcare that you receive through the government, like, I guess, would you say it's really good, awesome, or okay? And then I want to ask you, like, really specifically, like, quality of the cannabis that's available in the program.
Sure. So my experience with Veterans Affairs Canada was probably like most veterans. Like, you run into a big wall of bureaucracy, and it's not like when guys get out of the military medically, they get out and they're like, all right, well, I'm healthy and I'm ready to transition, right? Like they need a bit of help. And so when I got out, I definitely experienced that, but I was fairly proactive, and I was lucky that I connected just before I got out the link between the physical and mental, and knowing that, and cannabis isn't a save all, right? Like that's one thing I'll say right off the jump, fellas. It's another tool in the toolbox. But I mean that with breath work and mindfulness and meditation, those are really what were the key for me. So in terms of the healthcare that I received from as a Canadian veteran, I'm all set, right? Like my personal experience, I was good, right? But I was fairly proactive in figuring out what was available for me. Not always the easiest thing in a federal level bureaucracy like a VA or Veterans Affairs Canada. So that was my experience personally as a veteran accessing healthcare. And then the question about the quality of cannabis, it's gone up. So, in 2013, 14, you had a handful of what we call LPs, or licensed producers, who are federally licensed by what's called Health Canada. So like your FDA, and they can be audited, they can be inspected. There's analytics tests and COAs that have to be done on all the cannabis. So from 2014 14 to 15, the cannabis was middling, right? Like nothing that you'd write home about, but nothing that you would complain about either if you were getting it through the Veterans Cannabis Reimbursement Program, right? Like who complains about free dope, especially veterans who, could really use that. So, but in all seriousness, the quality has gone up, and it's not just dried flower anymore, right? So veterans on average are prescribed about 3 grams a day, and then if you're prescribed any more than 3 grams a day, you need a specialist exemption for the exemption letter. So if it's a psychological reason, you'd have a psychiatrist do it. A physiological reason, maybe a chronic pain specialist or something like that, and then you can be prescribed all the way up to 10 grams a day or 300 grams a month.
Thanks.
That applies to both flour and concentrates, or whatever form is.
Sorry, man. Yeah, but whatever consumption method. So right now I'm with Shoppers Drug Mart. And that's one of the reasons why they're going to be a long-term leader, because although they're licensed as an LP, they actually are a retail distributor, and they have 35 different brands on their platform. So I can get 510 vape carts, I can get Pax pods, I can get topicals, I can get sublingual oils, I can get gel caps, I can get edibles, I can get dried flower, whole flower format from 7, 3.55 gram, and pre-rolls. Literally, there is no consumption method that they don't have. And then there's all sorts of interesting things that are coming down the pipeline.
And you're working with your physician and your primary care team to go over the effects and what it's doing and how it.
Negative. No, negative, man. Actually, so the way that it works in Canada is approximately 8% of physicians in Canada are comfortable with prescribing cannabis, which means, there's only select physicians which do that. So I'm sorry, just give me 1 sec. So there's only a select amount of physicians that do that. So usually it's not going to be your primary care physician. And again, in the case of Shoppers Drug Mart, anybody that you're dealing with in terms of customer care, or when you call up as a veteran or as a civilian patient for that matter, you're dealing with a pharmacist. And they'll educate you on dosing. They'll educate you on consumption methods, on different strain profiles and terpene profiles, and what the effects of those could be.
How did you arrive at 3 grams? Was there some scientific process or something that was involved there, or was it just an arbitrary kind of, let's see what this does?
No, traditionally 2 to 3 grams a day is what most civilian patients and veteran patients were seeing. So they thought that was fair, and that's the 3 gram a day mark in 2013-14. A GP, like a general practitioner, could write for up to 10 grams, but they actually changed that in 2016. So you need a specialist exemption for above the 3 gram limit.
Arron, we were talking about the VFW and the DAV, all these acronyms about veteran support organizations that we're all part of, one or all of us. But what's the kind of counter in Canada? Do they have something like that? And what's their stance towards cannabis with it?
The Legion would be we have the Royal Canadian Legion that's been around since after the First World War. There's 300,000 members plus, but a lot of those are civilian at this point for a variety of reasons, but it still is a very veteran focused organization. So the Royal Canadian Legion would be our equivalent to that, and their outlook on cannabis up until recently has been basically a non-stance. But they just started up what's called the Legion's Veterans Village in British Columbia. And what that is a $313 million project over the next couple of years. And it's going to supply 300 units of market price housing for veterans. And they're going to have a standalone center of excellence for evidence-based research into plant-based therapeutics and its effect on healthcare and the veteran population.
Thank you.
Yeah, that's amazing.
I'll send you guys the presser for that. I'll send you guys a press release so you can take a look.
Please do. Every time we talk to you, it seems like we have to, well, me anyway, I got to push away from the desk and take a couple breaths. It's like, this is going up like just up there. You know, it seems so reasonable. Once again, Canada, you seem so reasonable.
We are reasonable people. We are reasonable people. And Canada is, you know, Canada is in my opinion, like as a Canadian vet, the most quietly patriotic country in the world. Like you can ask 100 Canadians, what do you think about, you know, political leanings, the wars, Afghanistan, and you'll get 90 different answers. If you ask what's your stance on veterans in Kit, it's much like the US. You know, political leanings aside, you'd be hard pressed not to find somebody in Canada who doesn't support veterans or veteran health care. And with the liberal attitudes that we have here towards cannabis and psychedelics, I mean, we have blanket insurer coverage for ketamine-assisted psychotherapy.
Right on. Are you good? So you're moving into then like psilocybin and other psychedelics as well?
Correct. So the two ways to access that in Canada currently would be a Section 56-1 exemption under the Controlled Goods Act, under Health Canada, like your FDA. So what that does for veterans is you can get a patient exemption or you can get a physician exemption. So the physician can apply to Health Canada and say, hey, for purposes and then he gets his exemption, and then you can get exemptions for veterans or for civilians, but veterans are doing it now for psilocybin assisted therapy. So not currently, you know, the regulatory landscape in Canada doesn't currently allow that. It doesn't have coverage, but it'll be next. Canada right now is undergoing I don't want to call it an overhaul, but they're most definitely looking at the COVID-related mental health care crisis in the greater population. But veterans are a sensitive population, and in my not so humble opinion on this topic, veterans will be the next step in broader access to psychedelic assisted therapy.
Well, that whole tip of the spear thing, yeah. It sounds really like a renaissance is what's occurring up there, and just a big beacon, a light from a light tower that's going around the world, and we'd be wise to pay attention, right? The leaders, we're over here, we're speaking to the echo chamber, right? With us, we've all been in this for quite some time. I hope that people in positions of power start to listen and start to pay attention to what it is that y'all are doing up there, because it is important, and you guys are worthy of praise because it's significant. Now, going back to the medical program, are you guys documenting these statistics? Are you documenting the outcomes and stuff like that? And is it being disseminated and discussed throughout your communities and then the halls of power?
Absolutely. So there's a university in Canada called McMaster University and the DeGroote School of Medicine, and it's like your John Hopkins. You know, like it's a very recognized research academic institution in North America, internationally, but specifically in Canada. So the DeGroote School of Medicine has a center for medical cannabis research, and they are also the home for what's called the Chronic Pain Center of Excellence, which I sit on the advisory board for, and under the umbrella of chronic pain in the veteran community, we sit opposite the scientific advisory board, and we have the ability to choose different modalities and non-traditional therapies for veterans with chronic pain. The first one we chose was cannabis, and we have the ability to run SNAP or randomized control trials, or RCTs, double-blinded, peer-reviewed, and they are then sent to the British Medical Journal to begin the peer review process. So an evidence-based whole family or whole person approach is what Canada is trying to do with veterans. So logically, if you look at the population being predominantly male in the US Army and Canadian Army, UK. So if these guys suffer at chronic pain at 5 times the rate and 6 times the rate of post-traumatic stress and traumatic brain injuries as a civilian population, then, you know, logically that would lead you to believe there's probably some stressors on the family or on the, you know, on the support system for that veteran. So you can't just look at the veteran and say, hey, you know, this guy used to bang it out in the Surrey district or Panjway district, or he used to do that. So he has all these benefits, And then his family is kind of left by the wayside because you move as a family unit, you know, like I'm sure there's a lot of fathers and husbands on this call, right? So, and that's the approach that both the Chronic Pain Center of Excellence at McMaster University, as well as the Center of Excellence for Post-Traumatic Stress at Queen's University in Canada. So that's the approach that we're taking up here.
So are they the is that the institution that gives the government or the information to say this is a legitimate medical this has a legitimate medical properties, or who convinced the politicians in Canada to say, you know what, this has been wrong for a while. This could potentially help our veterans. And was it a government establishment, like research establishment, or private, or just a bunch of individual or independent research studies?
No, it was actually in 2001, the Canadian Supreme Court. So the decision wasn't based so much on, there's so much, you know, empirical peer-reviewed data here that we just have to, you know, let veterans or even the greater civilian population have access. It was a human rights issue. You know, it was at the Canadian Supreme Court said that he stood up and said, I'm a free man in the freest country in the world, and I want access to medical cannabis. And the Supreme Court said, you're absolutely correct. 5 years later, the first veteran got coverage for it.
Right on. Yeah, no, I can't.
Can y'all start sending some of that maple syrup down?
Actually, I cannot. Highly illegal at the federal level on both jurisdictions. So apologies, bro. I cannot do that. But hey, if you come to Canada, it is federally legal, and I can give gifts to people of the under the age of majority. So, you know, we have recreational stores 5 minutes away from me, you know, that are provincially run.
We're gonna get a field trip put together here soon. Careful what you wish for.
Hey, that's all right, man. Once the travel restrictions lift, I can't wait to start doing business and living life like a real person again, traveling and, you know, shaking hands, bumping knuckles.
Speaking of traveling, Arron, any other countries that you know of that, you know, America, Canada, and who else veteran wise is on the scene and using cannabis medicinally? Do you know any other countries?
UK, man, UK for sure. The majority of guys that I run into on the international scene are Aussie, New Zealand, UK, Global War on Terror dudes. You know, the Great Britain guys, English guys, like all from that, and then US and Canadian guys. Like, you know, that alliance, like the Australian, Canadian, UK, US alliance, has been holding strong since, you know, World War I. So ain't broke, don't fix it.
Yeah, you know, we really discussed reaching out to like some other countries and, you know, non-traditional, because we really want to open this up and understand the world perspective. Because, you know, much to your point, we've done a good job of rallying the troops, you know, the usual suspects, but we'd like to get some wider perspectives, you know, because we need to inform the kind of what the information is and, you know, kind of change the narrative a little bit. But yeah, that's pretty interesting. Thank you.
Yeah, no problem. My suggestion there, Arron, would be look at countries that have medical cannabis programs and look at countries who are in the global war on terror. You know, or prior. And I'm not saying guys who were before that generation or after that generation. I'm just saying the majority of guys that are coming together on this topic are from there. If you find the country with a medical cannabis program, and you know, and it doesn't have to be global war on terror either, a high concentration of veterans, and I think you've got your start right there. Because like most of us know, you guys are in the US, I'm Canada, UK. If it's legal to do at some level, veterans are availing of cannabis for relief from a multitude of symptoms.
Yes, sir. We will use it, legal or illegal. It will not deter us. We've proven that. Now, I wanted to welcome Mr. Ryan Miller to the conversation. Ryan, just to catch you up, we're here with Mr. Arron Victory from Canada, and he's given us a kind of rundown of what they got cooking up there in that great country. So we have a list of questions that we've put together. If you have any that you'd like to ask or just kind of chop it up real quick, you're more than welcome to. Or later, is what it is. Anybody else? Tony, Robert, you guys want to jump in?
Yeah, I'm curious if veterans, when they're on probation or parole, if they're able to still get access to cannabis through the VA, through Canadian's VA, or do they stop that access if they're, I'm sure if they're incarcerated, they'll stop it, but if they're just medical patients, and need cannabis, or do they still allow them to have access if they're, on parole or probation?
No, that's a good question, Tony. So you know what, I can't answer that question. So obviously not a lawyer, bonehead infantry guy, but my gut reaction, my knee-jerk reaction to that question is the parole part. Like, if you just got out, I'm not so sure. Probation, I don't think so, unless maybe there's but it wouldn't matter. Like, what are they going to mandate piss tests for federal level for cannabis? It's legal here. If you're the Asian majority in your province, you can avail of it. So my gut reaction would be no, man, but I'll get your contact information and I'll get a better answer for that question.
I'm gonna hop in there on that one because I'm very familiar with the few veterans treatment courts that have been springing up throughout the country. I'm not sure if you guys have anything like that, but the veterans treatment courts and from what I understand, the two that I've worked with, if you do have a patient, if you are a medical patient for cannabis, they do not restrict you on that. If you're going through as a defendant in that program, which programs can last over a year actually with the treatment program to be able to get the treatment and get the DA to drop the charges. So that's actually a really good program. I don't know if you guys do anything like that in Canada, but it definitely saved my life. So if you don't, we should speak about that offline sometime.
Gotcha, man. No, I'm not aware.
Aaron, I saw that you posted about the Newly Institute. Would you like to let us know what that's all about?
Sure. So that's a company that I'm a founder in that's going to be a national group psychedelic assisted therapy clinics. So the regulatory landscape in Canada is shifting at a rapid rate, and we're hedging our bets on, well, we know that veterans have coverage. So we're going to anchor in veterans. And because, I'm there and I'm a founder in the company, we have a focus on them, obviously outside of, just a purely business perspective. So just from a corporate social responsibility perspective, like, I wanted to focus on military and RCMP, and so did the rest of the team. And we have an unbelievable medical team and leadership team. Like, our chief medical officer is a gentleman named Dr. Rob Tangay, and he works at the Hodges Brain Institute at the University of Calgary, and also works in the operational stress injury clinic in Calgary. And he's actually one of few physicians in Canada that has 2 fellowships, one in pain and one in addiction. So he's actually developed the protocols for the psychedelic assisted therapy. So that's in a nutshell what the Newly is going to do. But we're also going to be applying for exemptions for veterans pro bono for psychedelic assisted therapy, psilocybin, and we're a company that's going to go public. We adhere to all Health Canada regulations, but we definitely feel like veterans could be the next step in that broader access, and that's what the Newly is all about.
When you mention these RCTs, you call them the randomized controlled studies, trials, I assume you're going to be doing those as well and have the kind of leeway to conduct those in the psychedelic side of the house. But for the medical cannabis side of the house, whose products do you guys usually use when you're trying to conduct these RCTs? Like, so over here we have the University of Mississippi, and they provide all of our researchers this really bullshit.
Nothing like that. I'm grateful, Rico. That is absolutely nothing like that. So we could have license, like it's shameful what really, the quality of cannabis, the access problems. It's so what we do in Canada is a private company could do that. If they wanted to pony up 1 point whatever million for a randomized control trial, the absolute gold standard in evidence-based research, they can. And if they want to say their product can do this, they can. And there is companies out there, like there's companies that focus on dried flower, pre-rolls, 510 vape carts, packs, pods, things that we traditionally look at as adult use or recreational. And then there's other companies who have, sublingual oils, gel caps, topicals, things that look like or have a more traditionally medical bent for the cannabis program. So the medically focused LPs, they're the ones who are putting money into the observational studies, the randomized control trials.
Man, I wish I would have gone to Canada before I enlisted in the military. Shit.
You can grow a beard and smoke dope, man.
Hey, yeah, I like maple syrup too. But
I have a question on the exemptions. That you mentioned that a couple of times, and I'm trying to wrap my mind around the veterans. Like a civilian can't get an exemption to try mushrooms or psilocybin. What's the exemption?
No, they absolutely can. No, they absolutely can. Tony, I was just speaking to it in the context of the newly and the veteran focus, but being a veteran has nothing to do with the psychedelic exemption.
But the exemption, what is that specifically? What are you being exempted from?
So psilocybin containing fungi in Canada is still a prohibited substance under the Controlled Goods Act. A Section 56 exemption lets you access that substance for a limited period of time under these set templated rules.
That's a wonderful thing that you have access in that way. If you're suffering from some ailment that treatment resistant from pharmaceuticals or something, that you have an avenue that you can get access to that through an exemption.
That's exactly what it's there for, and I couldn't agree more, man.
I'd like to learn some more about that. I'm gonna look into that some more.
I'll send you some information, man.
Aaron, I know that we could probably ask you questions all day, but the last one I got is medical program wise, what if you could come down and tell our medical program what they don't know or what they need to know before they start it, what would you tell them? Like, what's the biggest thing that our medical program needs to know before they start, like if at the federal level?
Mm-hmm. So complete admittance that I'm a layman in international political studies, but my personal, Aaron's personal opinion is the best way forward for a group like you guys or the greater collective group of veterans who we know are out there that are the majority that would love to avail of medical cannabis in the US. If I was to give you guys my 100% solution, I would say do it by state. Find a state that has a medical cannabis program, and then find somebody that's a congressman, a senator, a governor, a councilman, doesn't matter, that has a little bit of juice. And even if they're doing it for less than altruistic reasons and they just want to grab, who cares? Right on. Listen, this can be a train, and find that person and then do it at a state level. Because at the federal level, man, like, to say you'd be dulling your machete, going through the bureaucracy at the federal level in the US, like I don't even know. And like the MORE Act and the Safe Banking Act, like, I had originally, uneducated, was a proponent for those things. My knee jerk was like, that's fantastic. But now I'm being educated on some of my, my friends and my contacts that do know that there's some things in there that may not work out at the federal level. And it's a far more nuanced and layered conversation once you get up at that level of government. I would say keep it at state and municipal. I mean, I think it was Rick Perry in Texas, just through his support behind the Veteran Psychedelic Project there. I mean, at Texas, not a traditionally liberalized opinion towards drugs. So, or prohibited substance, sorry, that I should say. But I mean, they have therapeutic benefit. I think that it's going to be more and more obvious. And my opinion is that jury's still out on medical cannabis. In all honesty, guys, like the evidence just isn't there for physicians or a college of physicians or someone to say that. I think, again, personal opinion, that psychedelics will be what we originally thought cannabis was going to be.
So, Arron, with all of this greatness going on that you guys got, what have been some of the shortcomings that you've had to deal with, and how have your advocate community or legislators overcome some of these challenges, and how did you come out on the other side to get a lot of this access or whatnot? I don't know if that made sense to you.
No, totally, man. You were a little broken, but I'm tracking what you were. Yeah, did you got me, Robert?
Yes, I got you.
Cool. So I got the gist of what you were asking me, man. So some of the downfalls that we saw was that once companies knew that veterans, these clinic groups knew that veterans were the only demographic, and they held that value in terms of revenue generation, they got money for veteran patients coming through. Completely legal, completely above board, no issues. But once that happened, veterans got involved in the clinics and started owning some of the clinics. And then, it was very divisive within the veteran community once you put that element of revenue generation in there. And to be honest, most veterans in Canada are sick to death of the veteran focused cannabis clinics, because they see them putting patients, or profits above patients, sorry, and they are moving over to Shoppers Drug Mart, that pharmacy group in Canada, in larger and larger numbers. I mean, you get 35 different brands, and if you go with one of the licensed producers, you have to just avail of their products. And then you would have to do something called splitting your script to go with another licensed producer. Administrative nightmare. So, or you could just go to Shoppers Drug Mart, get your information from a trained pharmacist on consumption methods and dosing, and what you should be taking, and avail of 35 different brands and growing. So 35 different brands, but they have multiple SKUs with each brand.
I got a question real quick.
Yeah.
So you mentioned a couple of different times, right? Cannabis is not a silver bullet. I think we all here on this call can agree with that statement, because in my personal experience, that's the truth of the matter. Breathing, like you mentioned, is called for. Exercise, being able to engage with my counselors and friends and open, honest discussion about what I'm feeling, when I'm feeling it, reaching out, all kinds of things, right? Now, what are some of the things that the veteran community in Canada are engaging in with great success, that are assisting, in that overall process? Like, what are some of the other tools outside of meditation and breathing? Over here, we have something called Veterans Walk and Talk that's starting up. So a whole bunch of vets get together. Sometimes some do psychedelics, some do cannabis, and they just go for a hike, get somewhere, talk, and then go back. Can you maybe touch on that a little bit?
We have multiple different nonprofit groups that do things like that. Everything from Prince's Operation Entrepreneur, that takes veterans that are looking at transitioning out of the military, or are currently in the military for that matter, and they have an entrepreneurial aspiration, and they take them at one of our major universities, and the business faculty runs them through a templated program and fire hoses them with information in terms of starting your own business, incorporating, and counting. So, everything from that, from Wounded Warriors Canada, which is a group that has agreements with all the major provincial policing organizations, federal level policing being the Royal Canadian Mounted Police, and obviously veterans. And they have programs like trauma resiliency and before operational stress. And all evidence-based. They work with major Canadian academic institutes and have a research coordinator or a research team. And then, my cannabis brand, we're going to work with different groups that are veteran and first responder focused nonprofits. And there's no shortage of places for veterans to go. There's everything from guitarists to vets to guys that build different models, and so there's basically everything under the sun, right? So there's no shortage of private or public support. If you know where to look, and I know a lot of veterans have problems with isolation, so that's an issue for sure. But everybody knows somebody, right? Even the guys that are in the darkest hole usually have those one or two guys who they'll still communicate with. So as long as they're talking to one guy, if he knows about the program, he can take him out for coffee, he can do whatever. And then I'm sure a lot of guys on that call had the experience either reaching out or having guys reach out to you. So, but no shortage of different programs outside of just the medical cannabis.
So what are the qualifying conditions for cannabis? I guess I might have a I'm not going to say unique, but a reason I started using cannabis again. I used it recreationally before. I used it as to help me through some stuff, but that was to really help me through the withdrawal of the medication that the VA was prescribing me. And literally, I was smoking I smoked probably an ounce a week for 4 weeks. It helped me get over a very, very strong opiate addiction, benzodiazepine, just some bad juju that the VA had no other choices to give me besides that to help me with my pain and my condition at that point in my life. And I really give cannabis the credit where I needed it. I used it to get through the really difficult parts of opiate withdrawal. Is that something that I'm just using that as an example where instead of going to a inpatient rehab, which I really didn't have an option to do at the VA at that point, but is the program flexible enough to incorporate stuff that helps with leniency, is it flexible, and is it a wide range of symptoms that you can have in order to fall under the program?
Absolutely. Yeah, it can be physiological, it can be psychological, traumatic brain injury, major depressive disorder, post-traumatic stress, chronic pain issues, musculoskeletal. So yeah, to answer your question, absolutely, they've a broad scope.
Thanks.
I had a question on the psilocybin. Arron, is it grown by the VA or? Yeah, is the psilocybin fungi grown by the VA and if so, or who's prescribing it and how are they prescribing it? Is it microdosing or do they have some community gathering in a ceremony and is there integration work after the ceremony or after it's prescribed? Is there some kind of is it a heroic dose or is it just a microdose? Can you explain how it's being used, psilocybin?
Certainly. So it's not being prescribed because it's still prohibited. So those Section 56 exemptions are the only way to access it. So if a traditional physician prescribing it's not going to happen, you would have to go through the actual administrative process with Health Canada to get the exemption. And then how it would be used is traditionally with psychedelic assisted therapy. And then MAPS Canada has a protocol that usually consists of two clinicians or therapists in the room, and then the patient being blindfolded and they're given a dose. Now, the dose for psilocybin, I actually can't speak to. So I don't know, if they're using golden teacher future and it's, a 0.5 gram cap, or they're doing 5 gram flood or heroic doses like you said. So again, I don't know, but I'll get you the answer, Tony.
Thank you, Aaron. Thank you.
Not a problem, man.
Councilmember Crowitz, would you like to jump in?
Yeah, man, I don't have the questions in front of me though, unfortunately. Let me pull it up. You want to come back to me in a sec?
Yep. Mr. Victory, what kind of harms have been reported from veterans involved in this cannabis experiment or program in Canada? Has there been anything reported that could change people's minds about the validity of it or the ability of veterans to have access to it?
Yeah, less the validity and more, so the first thing I would say is veterans that haven't had experience with cannabis getting into a high THC product and then having an issue once they've consumed it because they've dosed too high. So that's definitely, like low hanging fruit, that like the consumption methods, but going back to, getting it into the hands of pharmacists and people who actually know about that. And the program does have its issues, but it is progressing. Other than that, the overprescription of cannabis was an issue in the early times because a GP could write for 10 grams a day. My personal opinion is that that is exceptional. And this is coming from a guy who's been on 10 grams a day since 2014. I know I'm an exceptional case, and I consume 10 grams of cannabis a day, but I consume it in edibles, sublingual oils, gel caps, topicals. I actually don't combust cannabis anymore. I haven't smoked a joint in years.
That's what's up. And do you use it for, obviously there's a myriad of things that people have used it for. Do you notice anything particular, maybe being reported like chronic pain or TBI or something like that?
Mood, chronic pain, and sleep, I think would be the most. And actually one of the harms would be anxiety. So a lot of guys getting, a high THC sativa leaning profile. I know, sativa and indica are misnomers, but for the sake of the conversation, that profile, again, somebody getting that and going, oh, great, like that looks good as a product, and trying it, and then their anxiety going through the roof and not, really knowing how to consume and dose properly. So that would be another issue that that veterans would have seen in the early days.
So yeah, man, on that same note of cannabis for pain, just sort of a couple of questions really rolled into one. Especially in the early days of the medical cannabis programs, we got a little pushback from police because they felt like everybody was claiming pain, but there are an awful lot of conditions that are painful conditions that cannabis seems to help for. We see a lot of pill reduction, the less opiates that the patients are taking. So kind of tell us a little bit of those issues from the national perspective up there.
In terms of veterans that are using the cannabis reimbursement program, reducing the amount of opioids that they're taking?
Yeah. Well, on both sides. So on the one side, are you hearing the same kind of reports, the same kind of issues? And then on the other side, are you getting any pushback? Is there any complaints that people are that there are too many patients in one particular category or another? Sort of micromanaging like that.
No, not really. There's very little micromanagement when it comes to the program. I mean, the program's been around since 2007, and there's only been a couple changes, and the changes are that a general practitioner cannot write for more than 3 grams a day. That requires an exemption. Not something that I would even disagree with, because to be honest with you, it's not really it's not really a hassle administrative wise, Michael. So, I can't say that we've run into any of those particular issues.
I got just kind of a follow-up on that based on how the question was posed. Out of curiosity, what is your relationship with the Mounties or the Canadian police and stuff like that? Do you have a good working relationship where you can meet with these people? Or do you have veterans who are being harassed on the streets because of their use of cannabis?
No, absolutely not. The rules differ from province to province, but if you're the age of majority, you can have 30 grams on you wherever you want to go. As a veteran, I have a prescription for 300 grams a month. If I wanted to, I could have 150 grams a month. I could walk up to an RCMP officer and say, "How's your day going, Constable?" And he'd say, "Not too bad." And I'd say, "I have several ounces of dried cannabis flower on me." And he'd say, "Right on, man. Right on. Can you get it in my way so I can deal with some real criminals?" Or
Wow.
yeah, no, zero issues from RCMP. And like, there's rules in terms of where you can consume cannabis, province to province. Obviously consumption while driving and intoxication and, issues like that, they're going to give you a problem. But if you're a responsible consumer, you're going to have zero issues with any provincial or federal level police in Canada.
A follow-up on that. We've definitely, in more recent times, in that same vein of interacting with police here in the U.S., they've complained about a lot of things that they seem to be causing. And from what you're saying, it sounds like this is more backup for that argument, that they would say that just having cannabis in a storefront attracts crime, it brings crime into the neighborhood, that we're preying on vulnerable communities, that we're preying on poor and African-American communities. All these things seem to be a byproduct of the actual, kind of accommodation that we've made to them, to follow the rules that they've set up, the arbitrary rules that they've set up here in the U.S. that have created these problems. Like, for example, not being able to bank and having bunches of cash sitting around, in the U.S. So I wonder if you could contrast that a little bit, safety issues around the dispensing, the cash, the business of cannabis.
Yeah, all regulated at the federal level through Health Canada. So we have two streams. We have the medical cannabis stream. So I go onto Shoppers Drug Mart as a medical cannabis patient. I go on my phone. I go through the products. I go through edibles, oils, concentrates, hash, dried flower. I pick the things that I want as a veteran patient. It's all online. Then it's shipped to my house. Comes right to my door. As an adult use consumer or a customer, I go into in different provinces is regulated differently. Some have private retail models and some have government run retail models, but whatever province you're in, I mean, the stores look fairly similar. They look like high-end dispensaries. There is rules in terms of what you can promote on the curbside and things like that, but nothing incredibly restricting that they wouldn't know that you're there to sell cannabis.
So, bring up the police and the crime. The issue with, or the argument that the children are going to be affected by the legalization of cannabis. Have you seen any rise in youth use, or has there been any reports, or have you seen anybody giving their medicine to children?
So personally, I haven't seen that, but if you wanted to get that actual information, if you go to Health Canada /cannabis.ca, they have all that information. And there's actually another link that I sent at you, but I can send around to you guys as well. And it's actually Statistics Canada, a federal level government organization, and Veterans Affairs Canada update the cannabis statistics for veterans specifically quarterly. So I can send you that information. And on Health Canada, you could take a look at the rules of safety, youth consumption, and trying to make sure that that doesn't happen. But I haven't seen anything like that. But to be honest, that's not in my purview. But you can definitely see the information.
Yeah. All right. Great. Yeah. No, I just wanted to bring it up. All of us majority of us were watching the UN narcotics summit last week or 2 weeks ago, and they brought up how it was destroying the youth here. Now that cannabis is recreational or medicinal. I haven't seen it either. I mean, I'm somebody that used cannabis before I was an adult also. So, but it's something that is a arguing point for a lot of the naysayers to cannabis. So I appreciate you answering that.
Yeah, and actually Shoppers Drug Mart has a pediatric program, so.
And so last question here is around another prevalent issue, a couple of them, right? Still regarding public health, and something that often gets attributed to legalization of cannabis or the relaxing of drug laws and stuff like that. Have you noticed an influx of the homeless population in Canada as a result to your loosening of these restrictions around these substances? And also with respect to the injection sites for people who are suffering from heroin abuse, and they need some place to go to get clean needles and some advice and stuff like that. How has those programs assisted the communities that you're aware of in your country?
Do you know what, man? That you just stopped me. That's the first question I can't answer. I wouldn't have any insight on that.
Well, it's out there for anybody listening. We'd like to know. We're going to be doing some of our own investigation and research. That's what led us to Mr. Victory here. And we're very grateful again for having him join us tonight. Again, it's been enlightening for me. I always find myself just kind of blown back with how, again, reasonable it all seems to be up there. But I hope you are able in the future to join us again. And I look forward to collaborating going forward on whatever we can. But if we can figure out how to end this now, Pearson, I think that we'll call it a day. And give a shout out to ATN Fontaine, who's on the road, heading out on a well-earned, much-needed vacation. We hope he gets some deep R&R, and he comes back well-rested to tell us about his travels. But for all you out there in Facebook land, social media world, please look into the links and resources that have been provided here, brought up. Like they used to say on Reading Rainbow, right? Like, don't take our word for it. Look into it, you know? But I thank you again, dude. Anybody else got anything to add, or can we just shut it down?
Thanks a lot, Arron.
Thank you so much.
Thank you, Arron.
I'm struck with a strong urge to sing "Oh Canada."
Well, so listen, fellas, I appreciate it. Like I'm grateful for you guys taking the time and having me on. And like I said, you know, I like the idea of US, UK, you know, international veterans working together. So if you guys wanted to spitball on some strategy on how you could move things forward from, you know, like a legislative perspective or a regulatory perspective. You know, in my travels of building my cannabis brand, I ran into a few high-end corporate lawyers that like nothing better than helping veterans out, and they work both sides of the border. So